Hi, my name is Olga. I'm going to be performing the skills video of prenatal precautions. I want to start off with talking about the foods that are needed to be avoided um, while a patient is pregnant. We would say raw meats, deli, which could cause a lot of bacteria in most of them. And I would say also raw eggs because they have bacteria in there that can cause a miscarriage, or raw uncooked fish has a high volume of mercury, and then over-the-counter medications are not recommended, but it's best to advise your doctor. But if they are recommended, it's best to take them on your second trimester. Safe medication would be Tylenol because it helps, it's a less mechanism for miscarriages. Also prenatal vitamins are also recommended because it helps the mother's developmental and the fetus development, because it has folic acid and everything it needs for the mother's vitamins for keeping the baby and the mother safe. Also, the medications that are not required, that are not recommended, would be like aspirin, cough medicine, aspirin because during the 36 weeks closer to the due date, it might cause more bleeding for the fetus and the mother. Cough medications do contain alcohol, which is not healthy for the baby. When it comes to substance abuse, tobacco, and alcohol, and how it affects the mother and the fetus. Alcohol affects the mother, which could cause a stillbirth, or it can cause a miscarriage. Tobacco will have problems for the placenta and poor labor. Substance use can cause infections and mental health for the mother. How it affects the baby would be alcohol gives a baby problems with abnormalities of the skin when the baby's forming. Tobacco would be a low birth weight, and it could also cause the baby to have less oxygen. Substance use can cause the baby brain damage or any developmental problems that the baby might not be forming the way it should. Next, going on to traveling. When it comes to traveling, it is best to make sure that the mother has their supplies ready, and also know the type of blood she's in, and also wearing clothing that is comfortable. It is not recommended to travel the first trimester, but the second trimester is best because baby and mother would be more stable, and they can go on more trips. Also, when it comes to traveling, it is best to avoid high altitudes, which can cause the mother to have morning sickness and headaches. And then it's also best not to have the mother travel to high heat areas that can cause a lot of damage to the mother. When it comes to next, I'm going to talk about when it comes to prolonged travels. It is recommended that the mother stands and stretches every 2 hours. It can cause more DVTs, blood clots, so it's best to wear compression socks or something just to keep you moving. And then lastly, when we talk about dental care, it is highly recommended that the mother does keep up with the appointments and procedures that are allowed to be done would be cavity fills, crowns, X-rays are not recommended due to that the radiation for the mother, but it is best to keep up with all your visits due to that the mother might not have all the nutrients, and dental care might be affected. Thank you.